Hello and welcome everyone. Thank you for joining today's session on your favorite channel, Cancer Reach. Cancer Reach is an initiative by our very own tumor defeater, Dr. Krishnamani, to spread awareness about cancer and help patients and caregivers access the right treatment at the right time. We're here to talk about a condition that often goes under the radar until it reaches a serious stage, that is, advanced bladder cancer. While early signs like blood and urine may seem minor, bladder cancer can quickly become life threatening if not diagnosed and treated on time. This session is aimed at spreading awareness, busting myths, and helping people make informed health decisions. Without much further ado, let me introduce our doctor to you. Dr. Krishnamani has been associated with AOI hospitals here in Hyderabad since the past decade. He has continually expanded his knowledge and skills by completing fellowships from prestigious international institutions. Throughout his career, he has been an integral part of various hospitals and organizations across India, earning the recognition as one of the country's leading medical oncologists. He has served on the advisory board for clinical research. His commitment to advancing the field of oncology is further demonstrated by his leadership in American and European oncology societies. Hello and welcome to you, sir.
Hello, good afternoon. Welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. And today let's discuss about advanced bladder cancer.
So, sir, can you explain the term what is advanced bladder cancer? How is it different from bladder cancer?
See, bladder cancer means we are talking about urinary bladder cancer, cancer which starts in the urinary bladder. So, urinary bladder is part of the genitourinary system, which starts in the kidneys. There are two kidneys, there are two ureters, the tubes which come out of the kidneys, which go into the urinary bladder, which holds the urine and enables to pass the urine. So the cancer which starts in the urinary bladder or the ureter up to the renal pelvis, that is the kidney, there is an area called pelvis. So pelvis, the tube, ureter, and bladder, cancer which comes in this area is called bladder cancer. And advanced bladder cancer means the cancer which has spread to distant organs or lymph nodes. So, commonly, this is a variety called transitional cell carcinoma. So, when you talk about bladder cancer, the most common type is TCC, we say, transitional cell carcinoma. The other type is squamous carcinoma or rarely adenocarcinoma. So bladder cancer is tumor which starts in the urinary bladder or the tube ureter or the renal pelvis. And advanced means it has spread to lymph nodes where it should not spread. That is non-regional lymph nodes or to distant organs like lung, liver, bone, etc.
So, like, how does the spread occur? Like, how does it progress to such an advanced stage? What are the factors which help it to progress in this way?
See, factors which help to progress are suppose you have long-standing symptoms, you don't seek medical attention, it is high-grade disease. Yeah. And inherently, disease biology, we say. What is disease biology? Some diseases in some patients behave well. Same disease in another patient may behave aggressively. So that depends on the grade of the disease also. Grade is we say grade 1, grade 2, grade 3. When we look at the tumor under a microscope, grade 3 means high grade. That is, it is an aggressive disease. It has a high chance to spread.
So, what are some of the early warning signs which are present in the people with who are going to have this condition?
Blood in the urine. People may present with bleeding in the urine either in the beginning or throughout the flow or in the end. They may present with pain while passing urine. Okay. And in advanced stages, they may present with constitutional symptoms like weight loss, fevers, loss of appetite. They may also present with difficulty passing urine or urgency. These are all very non-specific. So urgency, that is, or frequency or incontinence, these are all symptoms which are normally seen even in benign prostate conditions. When the prostate gland enlarges and it presses on the urinary bladder, there is an urge to go and pass. there is a dribbling of urine. There is a feeling of incomplete voiding. After going to the washroom, they feel uh, they still have not passed urine completely. So these are not specific for bladder cancer, but for bladder cancer, one important symptom is blood in the urine.
Who is more at a risk of developing this bladder cancer?
So if you look at risk factors, right, men more than women, age, the older you are, the more risk of bladder cancer. Smokers, 50% of bladder cancers are due to smoking. Chronic infections, because of the infection, there is a constant irritation in the bladder lining, which is called mucosa. When there is constant irritation, that cell becomes a cancerous cell. That is called inflammation. Stones, kidney stones can lead to cancers over a longer period of time. Infections with certain parasites like schistosomiasis, there is an infection which can cause bladder cancers. Exposure to certain chemicals like arsenic, hydrocarbons, like in the paint industry, textile industry, glue industry, those people are at risk of bladder cancer. But singularly, smoking is the most important risk factor, which is responsible for almost 50 to 60% of the cases.
How would you diagnose advanced bladder cancer?
See, bladder cancer is how do you diagnose? You have to go inside the urinary bladder. So you will do a that is called cystoscopy. Like endoscopy is putting a camera through your foot pipe. Cystoscopy is a camera through your uh, bladder. Wherever you see certain suspicious areas, you will do a biopsy. So you do a cystoscopic biopsy and look under the microscope. If there are cancer cells, you have bladder cancer. Then you will do staging with a CT scan or a CT urography or an MRI. So this is the way you diagnose an advanced bladder cancer, whether it has spread to other organs or not.
Can you tell us more about the staging before we get into the treatment part of it?
So staging is first part is whether it is muscle invasive or not. So when you do a biopsy, you take part of the bladder muscle. If the cell has not crossed the muscle, it is non-muscle invasive. That is, it is early stage, T1 we say. If it has crossed the muscle, it becomes T2, T3, T4, any of the three. That is, it is muscle invasive. So crossing the muscle is muscle invasive. Not crossing the muscle is muscle non-invasive. That is T1 lesion. So this is a very early lesion. In this, grade 1 is very good. Grade 3 is not so good. It can recur. This is T2. If it goes beyond T3 and even beyond the bladder, it is T4. That is on the biopsy. If it goes to the lymph nodes, it is node positive. If it goes to distant areas on CT scan or an MRI, it is metastatic. So that is the way you stage. The first staging is remove a part of the tumor, examine it under the microscope, see if the muscle is infiltrated or involved or not.
And sir, what are the current treatment options for advanced bladder cancer?
So, see, advanced bladder cancer treatment is only chemotherapy. Advanced bladder cancer is not curable. Advanced bladder cancer, you're trying to prolong the life of the patient, reducing the symptoms and improving the quality of life. So, till recently, only chemotherapy was the standard. We give two drugs, gemcitabine and platin. When you give gemcitabine and cisplatin or carboplatin, you give it every 3 weeks, you give it for 6 cycles, you are able to control the disease and improve the lifespan of a patient. Today, you have immunotherapy and ADC, antibody drug conjugate. We discussed it last time, some 3, 4 sessions back. So today, combination of ADC and immunotherapy is superior to chemotherapy. So ADC and immunotherapy is superior to chemotherapy because it increases the survival of a patient almost by double. Patients taking chemo, on an average, advanced bladder cancer survive for 16 months. But patients taking the combination survive for close to 32, 33 months, almost double. So What has not happened in last 20 years has happened in the last 2 years. Chemotherapy is no more the first line. The first line is ADC and immunotherapy combo. So if it is available in our country, if patients can afford, this is the option. Otherwise, the option is chemotherapy.
So, sir, just to understand it better, surgery is not going to be an option for advanced bladder cancer patients.
Yes, but you will do surgery in desperate situations. Suppose you have torrential bleeding, which is not responding to radiation or any other treatment, then you have to do a palliative cystectomy, that is removal of the bladder for control of symptoms. But it is not standard. You removing the bladder doesn't help disease elsewhere. So palliative cystectomy or removal of the bladder will be done in those cases where your other treatments fail. And that is only to palliate, control symptoms. That is not for cure.
And, sir, how is like the quality of life of these patients with advanced bladder cancer?
So it depends on where all the disease has spread. So chemotherapy, has complications like nausea, weakness, loss of appetite, neuropathy, tingling and numbness in your palms and soles, fall in hemoglobin, fall in WBC count, loss of taste, etc. Immunotherapy has a different set of combination complications with your ADC. It can cause skin problems. It can cause neuropathy, high sugars. It can lead to thyroid issues. You may need thyroid supplementation. Your liver enzymes may go up and down. So both the treatments have their own set of side effects, but they are manageable side effects. Broadly, these patients, because of treatment, may have nausea, weakness, loss of taste, neuropathy, high sugars, skin reactions. Because of the disease, they may have you bleeding in the urine. Sometimes they may have clots in the urine, which can cause severe pain while passing urine. They may have weakness because of the disease progression. If it goes to bone, they may have severe bone pains. If it spreads to the lungs, they can have breathing difficulty, etc. But your aim of treatment is to improve their quality of life, to reduce their symptoms and improve their survival.
Sir, any lifestyle or diet changes which can make a difference for these patients after the diagnosis is confirmed?
Not much, but eat vegetables, fresh fruits, vegetables, healthy food. Uh, avoid red meat. Avoid nitrosamines, we say, and obviously quit smoking and take lots of liquids.
So, sir, now we'll go on to bursting a few myths. So, the first one is that blood in urine is always due to infection or the kidney stones.
Urinary infection can cause that, stones can cause that, kidney cancer, urethral cancer, bladder cancer, parasitic infections. If you are using any pills like aspirin, blood thinners, or low molecular weight heparin for heart issues or other issues, that can cause bleeding in the urine. Certain other conditions, autoimmune conditions which affect the kidney, can cause bleeding in the urine.
The second one is that bladder cancer is only a man's disease.
No, women also get, but the ratio is much higher in men compared to women.
The third one is that only smokers get bladder cancer.
Smokers are responsible for 50%. The rest 50% is due to other reasons, which we explained.
So, surgery is one of the best options for advanced bladder cancer patients.
No, surgery is done. So the best option for advanced bladder cancer is today combination of ADC plus immunotherapy or chemotherapy.
So, thank you for bursting these myths for us, sir. So, would you like to summarize for our audience?
What I would like to summarize is bladder cancer presents with painless bleeding. Bladder cancer is due to multiple reasons, but tobacco is one. So please stop consuming tobacco in all forms, stop smoking. Advanced bladder cancer has a low survival, but today advancements in the form of ADC plus immunotherapy. The name of the drug is enfortumab vedotin. We call it EV, EV plus Pembro. EV plus Pembro today is first line, works better than chemo, doubles your survival. So if cost is not a constraint, the only problem is the medicine costs a few lakhs. So it is out of reach for many of our patients. So for our patients, still chemo would be standard, but at least we know there is an option available. And with this, it is not curable, but definitely treatable and improves your quality of life and survival.
So, would you also enlighten us about the second opinion campaign which is being run by you?
So, since you know, see, cancer is the word itself is a deadly disease, it's a deadly thing. People sometimes don't know where to go, and they may, so they are in a dark about how to go about things. So, Cancer Reach, we reach out to people through social media. If anybody is diagnosed with cancer, wants to have a free second opinion, they can reach out to us on our WhatsApp number, which is posted, and send their reports, and we would give them a second opinion as much as we could help them without seeing the patient. This is purely so that they get an oncology, a proper professional oncology experience wherever they are in the country. After which, they can obviously consult the oncologist at their local place and take it forward. The caveat is we don't get to see the patient, but this is an initiative so that at least we show them the right path or the basic first things in diagnosis and treatment.
Thank you for this informative session, sir. And I hope maximum patients take the benefit of getting a second opinion from sir. If you or any of your family members or anyone you know in your neighborhood requires a second opinion, please do make avail of these services. Thank you for today's session, sir. Thank you for your time.
Thank you so much.